Thank you so much for coming back. If you've just joined us, we are here today on Health Matters Changing Steps, our mental wellness segment of Health Matters, talking about inkblotTherapy.com. And what we're going to do before we continue the conversation is just take you to inkblotTherapy.com. We're just going to wait for our producer, Rye Howitt, to bring it up. And we're going to show
Depression,
you a video clip.
anxiety, addiction, and other mental health issues affect 1 in 5 Canadians. Too many people are living in distress, feeling hopeless, frightened, and alienated. But the good news is, these issues are treatable. The most effective long-term treatment is psychotherapy. Sadly, for most of those who suffer, it can seem impossible to overcome the barriers to accessing help. At Inkblot, we aim to leverage technology to make psychotherapy accessible. We have built a complete online video counseling solution with the highest level of security and encryption. Inkblot is affordable and extremely easy to use. You will be matched with counselors most suited to your needs. You have the freedom to book and attend your session in the comfort of your own home. We have created the affordable answer to making psychotherapy available to the millions of Canadians who are struggling and deserve to feel better. You are not alone. Join us today and let us help. The sooner you seek support, the sooner you will feel better.
Wow. Just even watching that gets me excited. I think I'd love to hear is, so you identified that you struggled with your own patients and psychotherapy clients who had trouble getting to your office sometimes, and you had this vision. How did it get from that to that?
Yeah, I have to be honest. It's a funny story. So my wife was pregnant, and I was taking 6 weeks off work, and I was a first-time parent. And I thought to myself, how much work can a baby be? Why don't I start a big project at the same time? And of course, I now, in retrospect, know that was the most horrible thing anyone could ever think. But it somehow worked out. I think, so it's been about 1.5 years in the making, and it's been a lot of going over and talking to people and both providers and patients and clients, and really getting a feel for what people need and try to create that. And it's been, so after 1.5 years of working on it, when we launched, it's an amazing kind of seeing it come alive and start to grow. It's been an amazing feeling. And then recently we kind of have expanded to all over Canada, and that's been exciting. And that decision came from 5 or 6 therapists in British Columbia, in rural British Columbia, connecting with us and saying, one of them specialized in families with children who have special needs, and her clients really couldn't come to see her, so they had to travel 1.5 hours to come and see her, and if they have children with special needs, is an issue, and so she wanted to use the platform to just see her own clients and so on. So we thought, well, let's open it up and do that. And then since then, a couple other things have come along that were directions that were moving along. One is that we found that a lot of clients had very practical matters that were making life difficult. Financial difficulties, employment difficulties, legal issues, especially a lot of people who were in abusive relationships just needed information about kind of what their options were and how to escape situations and so on. So now we're starting to also add a layer of other providers and include kind of financial advisors and people who do kind of legal work and so on. And so if a counselor is seeing a client and identifies that this person just needs information how to deal with their debts or how to deal with legal issues or that they can just book those sessions. And so we're kind of looking at all the various ways that we can help someone who is suffering and not just purely from kind of the mental health, but just kind of difficulties of life.
Well, when we think of
life.
Maslow's hierarchy of needs, which we've talked about on this program before, what you're addressing is that some of those day-to-day issues that get in the way, if you can take some of those away, it can decrease some of the frustration and challenges that the individual. I'm so excited to hear. I think of even with, I do assessments for hormone replacement therapy for kids that are transitioning from male to female or female to male, and just asking questions around, well, how do I change my ID? Like, how do I get my identification changed, because my family's planning on going on a trip in a year, and my what I look like in my passport today isn't going to be what I look like tomorrow. So wow, that is just amazing that that's going to be available for people.
I think it's just one of those things where we just want to be able to help kind of, and as it's still mental health. The reality is someone feels down because they can't figure out how to navigate a complex bureaucracy
of life. It's also mental wellness.
Exactly. Right? And the other things that we're doing is we're trying to automate some things that may make things even, or will be for free. Some of the meditation components. And so kind of with that mindfulness part, for example, we're allowing people to just hold their phone, and so that their voice syncs with their breathing rate and makes things a bit more effective that way. So kind of trying to leverage technology in slightly other ways. And the last thing is our group therapy. So right now we have kind of a live education kind of small group, 4 to 6 people on the site. It's more affordable. And we're looking at expanding that so that people can, one, sign up for multiple sessions if they would like. And the other is to kind of try different new things that haven't kind of really been tried before. So having kind of a guided mindfulness session for 15 minutes for 200 people across the province, where everybody can just sit down and have a guided session for 15 minutes for free across the province all at once and on a Sunday morning. And kind of a very different way of leveraging the technology and try to do things slightly differently. So there's a lot of so we're very excited about kind of where we're going.
And this started from a parenting leave.
Yeah, it's we actually have our second child is due at the end of April, so I just have to make sure it all gets done before April. Now I know. Now I know how much work is required in raising a child.
Well, so. I predict, as when we first talked, I said, do you realize, I remember saying, do you realize how big this is going to get? This is going to get so big, because I think of the comment you just made about the mindfulness group. I was just at a school meeting on Friday, and I had teachers saying, okay, we know mindfulness is really great, but I'm not trained in mindfulness. So for a school to be able to say, okay, or a classroom, we're going to just tune into this and do a mindfulness activity that other school children are doing in other schools all across Canada. It also, what resonates for me with all of what you're doing is that you're using technology to make us one community, even though geographically we're a big community. But it's making it smaller, because whatever culture you are, whatever age you are, we share the human experiences. We share many things in common.
And I think technology itself is neither good or bad. It's a tool. It's kind of like a knife or anything else. It can be it can be used in many different ways. And sometimes technology worsens mental health. It leads to a lot of distancing. It leads to people being uncomfortable having face-to-face conversations because they're used to editing things. So there's a lot of it leads to a false sense of what goes on in other people's lives when everybody's Facebook stream looks wonderful. So there's so in some ways technology can definitely create a lot of distance and emptiness and non-fulfilling relationships. And our goal really is to do the opposite, is to leverage technology to bring people closer together, to create more accessible services, to automate things to where it makes sense, and really make things much easier for providers and for therapists. So it's so we're really our goal is to improve mental health and to kind of because in many ways technology has kind of made things slightly more difficult as time has gone on.
So what do your we have a few more minutes left today, but what do your family doc colleagues think of this?
Yeah, it's actually been, so myself, because I'm in conflict of interest, I can't refer my patients to the service.
But they could self-refer.
But they can self-refer and so on. And my colleagues initially kind of weren't sure, but, because...
Any doctor I've talked to is like, can you give me it? I want to be able to be able to...
I have to say that we have family doctors going on the site just to leave us comments saying how thankful they are. And in contacting family physicians, there have been family physicians themselves who've had struggles and difficulties, who have used the service themselves to seek help where otherwise they didn't feel comfortable doing. So
that's a struggle sometimes when you're. I know about 4 years ago I lost my sister, and it was just heartbreaking. And to be able to seek out and get help in a small community with most of the people I supervised, be like, what do you do? How do you find support? And I did find support, but I really like that you're leveraging technology. You are making the world smaller, but by the very fact that patients or clients can get involved, and then they have a choice between 5 or 6 people, and they can choose the schedule. It's I think if you come back in a year, we're going to be having a very different conversation, because it's you're going to have a lot more people that are going to be self-referring, because the word will catch on, and they'll have such a bank of clinicians, as you say, to choose from, who have expertise in varying different areas. Yeah. It's fantastic.
And I really and our goal is accessibility, and it's been the feedback has been amazing. The therapists have been fantastic in terms of, when they do community sessions, when they give talks and so on. To share it. And they kind of, have referred and then likewise with clients. People kind of come on and say, I was having a panic attack, and someone said, hey, listen, I'm doing this, and you should try this out. So it's been amazing seeing the growth from word of mouth. It's
awesome.
Yeah.
Well, thank you so much for coming and sharing.
I really appreciate the opportunity. Okay. Thank you so much.
So if you're a clinician and interested, you can go to the site and sign in as well, and a very extensive vetting process happens in order to be able to care provider on this site. And then if you're seeking specific support, I encourage you to go look as well. And thank you so much for coming all the way here.
I appreciate it.
Take care. Have a really wonderful day today. Bye-bye.